All right, everybody, welcome back to another Future Focused, where we are living at the intersection of business, technology, and the human experience. I am looking forward to today's conversation because I have more and more things scheduled and coming out on different and unique ways AI is being leveraged to do some pretty incredible things in the world right now. And so today's conversation, we're going to be talking about AI and DNA sequencing and what that means, what that looks like, and where that's going. So, two things before we get into the discussion. First of all, one, be sure to, if you find this interesting or know somebody who would, share it with somebody. And also, if you're not and you don't catch the whole thing, sign up for my Substack where I will write up my reflections and summarize what some of my biggest takeaways were from today's conversation. But without further ado, I'm going to jump into the conversation because I'm joined by Dr. Jonathan Hill, who is the Associate Professor of Cell Biology at BYU and the VP of Science and Tech at Wasatch. Did I say Wasatch right? Did I get it right?
You did.
I did. Right. Yes. I love when I nail it like that. So thank you so much, Jonathan, for being with me. And I love backstage and getting to know you through this. We both share the challenge of going by the long versions of our name and living in a country where everybody likes to shorten things. So already we've got a bond.
Yeah, thanks for having me on, Christopher. It's great. It's so true. You have a 3-syllable name and everybody assumes it should be 1 syllable, right?
Yes.
But
and
my mom
like,
always told me,
so.
yeah, my mom always told me growing up, if I wanted to call you John, I would have named you John. You are Jonathan. You know what? So I have stuck with that. I am Jonathan, the whole thing.
I love it. I love it. And, we've got a whole bundle of kids and they all have names that are not super short. And boy, when people call them by the short version, we're like, nope, like your mom said, if that's what we wanted to name them, that's what we would have named them. And it's not. So that's hilarious.
It does help with common names too, because like in high school, I had 2 Jonathan friends, but they both went by John. Right. Yep. And so I actually got to keep my unique name and have that distinction because I insisted on using the whole thing.
I will say
there are advantages.
There are advantages. And I know I run into similar situations where there's a fair amount of Chris's, and being the Christopher, there's not really very many that do. So I think it does have its advantages. All right. Well, I've gotten a chance to know you through the process and talking backstage, but others have not. So a little bit of background into you and your journey. Have you always been into biology and I mean, that's a pretty unique intersection, cellular biology, DNA, and technology. How did you end up there?
Well, the short answer is by accident. It's kind of an interesting
That's more
story.
common than a lot of people realize. A lot of people are like, oh, really? I'm like, yeah, actually I talked to most people who were like, this was not my plan.
Right. You just end up there. I mean, yeah, my story's, I think, fairly typical in a lot of ways. In high school, I was good at math and science. I grew up in the Silicon Valley. My dad was a computer programmer, worked for IBM and several other startup companies throughout his career. Most of my friends' dads were programmers, right? We were surrounded by computers in the 80s and 90s as that was starting to boom and to grow. And honestly, as is part of being in tech, companies would get bought and sold and my dad would get laid off and go find a new job and things like that. There wasn't a lot of stability.
No.
Good pay, fun jobs, but not a lot of stability. And so I wanted to get away from that.
Okay.
And so I said, I'm good at the science thing. I want to help
people. Was there a point
you
thought you'd go into tech? Was there a point you thought you did, and then you kind of went, no, I don't think so?
I mean, most people around me were, right? They were going to school to be engineers and to be software programmers and things like that. You get, I don't know, in my high school at least, I think this is typical, where you get kind of the artsy kids and then the science kids, and they're kind of separate. And I knew I was in the science group. And I knew my main motivation for career is I wanted something that paid well, supported the family well, could help others, right? And then could use my talents in science. So everybody told me I should go be a doctor, right? That's how you do those things. And so I went to college as a pre-med student. Started going through the college process. And, as part of that, I got a job to TA the genetics class here at BYU as an undergraduate. And then I was doing research with a professor in a lab and started realizing, hey, I really like this kind of thing, and started seeing that if I wanted a job that, paid well, was stable, and helped people, there were other options outside of medicine, right? There are other ways to do that. And being a professor and doing research in the healthcare space and things like that was a great way to have that impact. In fact, in some
Okay.
ways, maybe even a bigger impact than seeing patients one-on-one, right? Not
Being in
saying that we
family
don't need
practice.
those,
No, no, but it's
but
interesting because I've been in healthcare for a long time, in a lot of different areas, pharmaceuticals, healthcare manufacturing, primary care, all over the place. And the number of physicians I know who, kind of had this idea that, well, if I go into medicine and I go to be a doctor, this is what that looks like. And then
right.
they realized, like, oh, wait, it could, but it doesn't necessarily have to. And there's a much broader
Yeah.
landscape. And it sounds like you had a similar experience.
Right, exactly. And so I switched my junior
Okay.
year of college, decided I'm going to go to graduate school instead. Obviously, I wasn't on that track, so I had to switch everything I was doing, stop shadowing doctors, start doing more
Yeah.
research, all that kind of stuff, upheave everything. Went to graduate school, ended up going to Columbia University in New York City, which was a great experience. And then, did a postdoc and got my professorship, and I thought I was on my way.
Okay.
And really, what I thought I was going to be able to do is do this really cool research that really informed to doctors and helped them know how to better treat people, right?
Okay.
And when I got into it, I started realizing that that isn't an automatic process,
No,
right? We're disconnected from the lab and the clinic. And
there's a big
uh,
disconnect.
I was doing this research, I was finding things, but nobody in the clinical space was looking at that research. Nobody was checking it out and adapting it into their practice. And so that's where my second transition came, where I thought, how can I better make sure that this important research that I'm doing
Okay.
actually has an impact in the
Okay.
clinic, right? That it's not
Okay.
just going to get a publication in a journal that sits on a library shelf somewhere and maybe half a dozen people read it, kind of thing,
Right.
right?
Right. And you
I
end
want
up
to make sure
arguing
that
with
gets
your
out
peers
there.
in the academic space. And then, you do
Right.
more research and it just kind of, the snake eats its own tail.
Yes. And again, it's kind of one of those things where that's an important foundation. We need
Yes,
that kind
for
of
sure it
basic
is.
research. But what I saw was lacking, there was plenty of people doing that. What was lacking was that transition, right?
Yep.
And started working with some others who were like-minded in this area. Tim Jenkins, for example, another colleague here. And he was thinking the same thing. How do I make sure that we get this out? And we've really started to transform our work to be that bridge, to be able to take research that's happening in the university and make sure that it's oriented in such a way that it answers the right questions and that it gets developed in a way that can actually be applicable in the marketplace, in the public, and benefit people's lives that
Okay.
way.
Okay. So
So
how
that's
did
why I
you
have
make
that kind
that?
of
Because
dual
you were
role
doing
now.
the research. How did that transition happen? Because it's one thing to see it and go, okay, I'm doing this. Then to go, all right, now how do I start bridging this divide? What did that look like professionally?
Yeah, and I will say it's probably a work in process, right?
Yeah.
We are
Well, the
figuring out
fact
how
I
to better do
introduced you
this.
with the dual title, I think actually kind
Yes.
of speaks to that, where it's like, well, I've got one foot in academia, continuing to keep that research moving, and I have another foot in the commercial, in the corporate kind of sphere, the technology sphere of, well, okay, now how do we take this and actually translate it over?
Yes, and it goes back to like how do we make
Yeah,
sure our research is oriented and focused on the right kinds of things, right? How do
right.
we actually do that? So there is
I
this
love
give
I
and
love
take.
that call out that it's not just how do we take the academic and push it into practical, but also then how does the practical then also circulate back and go, well, let's make sure we're researching the right things because we run the risk of researching stuff that's like nobody actually cares
Cares.
about this. They
Yes.
actually care about this.
Right, and we've seen that. My first kind of foray into the commercial space was with a student of mine. He came up with a technology uh, that used CRISPR techniques to do things to mutate DNA in a unique way. And we thought, oh, other researchers are going to love this, right? Let's take this out in the marketplace. We went out, and they actually all said, no, actually, that's not what we want to do. We want to do this other thing that's kind of close, right? We were not completely off target, but we hadn't quite nailed what the need was out there.
Okay.
And so he's really good. He actually took this and started his own company after he finished here. Um, and he's pivoted that company to better meet the needs, right? But I still look at that and I think, how can we shortcut that process and make sure that we're getting feedback from the marketplace into research saying, here's what our needs are.
Okay.
Can you figure this out for us?
Okay.
Um, and here's the problem. Here's why I think it's always going to have to be somewhat this way. Uh, Research is risky
Yes.
and it's expensive,
Yeah, I was going to say
right?
it's also
For the
people do
output.
not realize how expensive
Yes. And
research is.
hard and slow and labor intensive. It is not an easy task, which
No,
means
it's
the
not.
incentives for a company are not very lined up, right? Also,
Uh-uh.
you're going to discover something in nature, can't really protect it. And so the incentives are not there for a company to really dive into this basic research.
Yeah.
Um, Universities, the governments, private kind of philanthropic institutions, they are willing to fund and take that risk and have the patience for that,
Yep.
right? But at the same time, there's a disconnect in academia then where we're just interested in curious questions,
Yeah.
right? And we're not thinking about what would be a benefit to a company. How do we make that transition
Yeah, there
there?
has to be some you run again, you can be on the polar end of either side of that. And I think that
Yeah,
spectrum is a really dangerous spectrum that we often don't get right. Where on the one end, you can have businesses going, hey, if it doesn't translate to the bottom line, I don't care. And it's like, well, we
hmm,
have to do research and innovate to discover new things. And that's often riddled with failure too. Not only is it
yep.
hard to do, but it's often riddled with failure where you do things and go, well, it didn't
The answer is
work.
no,
The
right?
answer is
Yeah,
no, it doesn't work. We did all that and it's all for nothing. Well, it's not for nothing, but you're not going to gain anything out of it. So you can
yeah,
be too pragmatic, but then, like you said, you can be on the other end and go, well, we just want to pontificate and think and research on what
hmm,
may. And it's like, well, but it's got to have some sort of practical connection. Otherwise, you're really not going to get the appetite, even of philanthropic academic institutions, because they'll go, well, it's got to go somewhere.
right. And so, yeah, so you can already see the chasm that exists between the two, right? And this
Mm-hmm.
is known out there. People talk about this chasm all the time. And how do you bridge that chasm? The other challenge that we've seen as we've tried to bridge it is that because this is new technology, because you're inventing brand new stuff, nobody out there understands what you're doing. You also have to teach them about
Yeah.
what you're doing and why it has a benefit and why it's going to work, right?
Yeah.
And so our solution was, like you mentioned, to have one foot in both sides
Okay.
and to be the bridge. And we realized that we can't just do research. And even if we're trying to think, hey, how can this go to market? If we just patent it and the University Tech Transfer Office takes it, people are going to look at that and say, well, I don't understand it. It's new, it's different. Is it going to work? Right. And so it's not an automatic transition. It's not like people are just sitting there waiting for your technology and they're going to grab
No,
it right
and
when you
you
make
know
it.
what's interesting about this is while we will get to the DNA sequencing component of this, I think some of these things are really important components to hit on because it's a lot of this stuff that gets glossed over. And then we wonder why we have such low success rates
Right.
in because we're like, well, we did it, but it didn't work. And it's like, well, right. But it's because you didn't think through that chasm between the research and practical application. You didn't
Yep.
think through the change management of, well, how do you bring people along for the ride? And I know I run into that in the tech field and in the human performance field all the time where people go, but this is really good stuff. And you're like, yeah, but nobody else knows that because you're on the
Yes.
cutting edge of it. And so to them, you say it and they go, that I don't get it. Like that goes so in contrast to what I'm familiar with. I'm not
Yeah.
seeing and you if you don't bring them along for the ride, they just cut it out.
Yeah. We forget that that was actually the initial reaction to the iPhone,
Yeah.
right? Was why
People thought it
would
was
you
so
want that?
stupid.
Yeah,
Motorola rejected the idea. I mean,
exactly.
Motorola, I know the folks at Motorola, they remembered when they were like, yeah, we saw this thing and went, nobody
Nobody wants
wants
that.
apps on a phone. What a stupid suggest. Like, no, that's
Yeah.
never going to go anywhere. Now we look at it and go, how could we ever not? And we're seeing some of the same
Yeah.
stuff with AI right now where people are going, no, we're not going to,
Right.
this is not helpful. And it's like, oh, yeah, this is going to be like electricity.
Exactly. Yeah. It's a normal process. So we really have to educate. We set up some really cool things to help this. We do have roles, both Tim and I, at the university and in the company. The company funds research at BYU through kind of a grant mechanism that just
Okay.
lets us freely explore. And then through the university tech transfer, they license back to the company technologies
Okay.
that they want to pick up. They kind of have first right of refusal
Okay.
there. And so, we've tried to create this partnership instead of just
I
two
like that.
separate entities. We are working together and
Yeah.
feeding back and forth and trying to get this to work. So
I
so
think
far it's been really successful. We're figuring out things still, trying to balance things, but it's been really good.
But again, that's part of the process. And I think even just what
Mhm.
you described there, there's a lot of wisdom in that and I think there's practical applications, whether you're formally doing scientific research in AI and biology or technology, or you're even just practically at work trying to get different ideas across the board. You just talked about, finding that mutual partnership and figuring out how you make that work. Sometimes it's going to work a certain way. Sometimes you're going to have to flex on how you
Yep.
pull it off, but getting that right is really key to success.
Yes, and it's been key that both the company and the university have been willing to be flexible and to bend and
Yeah.
to do things they normally wouldn't in order to help this go.
That's good because
So,
that's also a critical success factor there. If you get people who are like,
yes.
it's going to be exactly this way or else, you're like, well, I don't know how we're going to make this work because nothing ever goes according to plan.
Right, and tech transfer offices are notorious for being that way. They're like,
Okay.
"It's our way or the highway." They'd rather sit on a technology than give anything, and it's like, well, then nobody's gonna use it, right? Like,
Right.
you need to bend to be able to just get it out there.
Yep. Yep.
So
Okay. Okay. So then as you started, you've gone down this path, we talked about, I think, what are some of the most critical foundational pieces to even getting any sort of innovation right. How did you land on the DNA sequencing component? Like, I mean, obviously you're a professor of cell biology, so there's a pretty strong component to
mhm.
that. But where did you start to see the potential in, hey, where this tech is going holds a lot of potential for what we're trying to do here?
Yeah, there's 2 parts of it. First of all, I think my Silicon Valley background had a played a role in there. When I
I
was
would
in
imagine
graduate
it would.
school. Yeah. So we're talking circa 2007, right? This is when DNA sequencing was just becoming big. The first human genome was released in 2000, 2001, depending how you
Yep.
want to count that. Um, it had cost, hundreds of millions of dollars in order to do, but along the way, we had developed technologies to do it better, and that was just starting to take off in the mid
Okay.
2000s when I was in graduate school. And I got in on it early. Started doing data analysis and started looking at making new pipelines for data analysis during my graduate program. I have no
Okay.
formal computer programming
Okay.
training whatsoever. It's all just on the job as I've done it. Um, I like to thank my dad's osmosis a little bit for that, right? When he talked about his job around the dinner table kind of thing.
Yeah.
Um, so I started
Well, and I
pulling
think
into it
there's
and
something to I think there's something to it when, and little sidebar, but there was this kind of movement where for a while it was like everybody needs to learn how to code. And there was this big boom around that. And I think what people realized was no, not everybody needs to know how to write Python, but understanding the foundations of computer science and how these
yes.
things work, that is actually really helpful regardless of what field you're in, because you can start to see, ooh, technology might help in this way, this is where it might not be so great, and if we were to architect it, these are the kind of limitations we'd have to work around.
Yeah, and once you have that basic vocabulary, you kind of teach yourself as you go based on your
You do.
specific needs. So I knew what a variable was and a function. I'd never programmed anything, but I knew those words. I knew that vocabulary.
Yeah.
And now that we're in the internet age, that meant I knew how to do a Google search, and that's what it took to learn.
Yeah,
I knew what to search for. Um, YouTube wasn't quite around yet, or it would be a lot of YouTube today, right? If I
exactly.
was doing it. Anyway, so I was incorporating that into my research, and my basic
Okay.
research has always been on gene regulation in embryo formation.
Okay.
So my graduate work was on the pancreas. We're trying to look at stem cell technologies. How can we use that to help diabetic patients, especially type 1 diabetes? And then when I did my postdoc and in my when I got my professor position, I switched over to looking at the heart and how the heart forms in an embryo,
Okay.
right? And these are amazing processes. If you think about it, you started as one cell, one single cell. And that cell had to divide and change and all of this coordinated, regulated process to form you as a
Yeah.
person. right? And your eye cells are very different than your toenails, right?
It's
Things like
absolutely
that.
fascinating. It is
Yeah,
absolutely fascinating when you get into it.
but with all the same DNA,
Right.
right? They didn't change their DNA. That's the same. So there's this gene regulation process, turning on and turning off genes in the right place at the right time to make things happening. So I was bringing in this DNA sequencing, RNA sequencing, bioinformatics type stuff to start understanding
Okay.
these kinds of things.
And I'm
And
sure
then,
digging into some of that, I think one of the things where I can see starting to make the connections with the technology is there's patterns, hidden patterns,
yes,
all of this stuff that often to the human, it's like, that's very difficult for us to be able to see and analyze and interpret the complexities of these patterns. But I can see where all of a sudden you start going, hey, computers are really good at
yes,
looking for patterns and finding patterns and seeing where there's consistencies and where there's inconsistencies and how the pieces fit together.
right. I mean, there's only four bases, right? A, T, C, G, four
Yeah.
letters in the DNA. We humans tend to focus in on that. And so it just looks like mixtures of four letters, right?
Yeah.
We're not very good at getting the bigger patterns out of that.
No.
Um, and yet there's 3.2 billion of them in the human genome. So we also don't have very good attention spans. And so reading through that and trying to find patterns is not going to happen, right? But
No.
computers
There's a very
love that kind of
limited
stuff.
number of people on the planet in the human history who actually would even have an interest in sitting and doing nothing but looking at that, which is why it makes it
Yeah,
very difficult for humans to sit and make
right,
progress there.
right. But we do have good intuition. We can set up models. We can program things to
Yeah.
do the hard work for us, right? To do the
Okay.
busy work for us. And that's where computers are key. So anyway, so the last transition I think really shows the need to work together as groups. Because what happened was Tim Jenkins, my colleague, was looking at methylation patterns in the DNA. So now, if you look at this, you have your DNA sequence. It's the same in all your cells throughout your life, right?
Yep.
But different cells and different diseases and different time points will make different chemical modifications called methylations on the DNA in unique patterns, depending on the cell type, the disease, the age of the person, lots of different factors.
Okay.
Okay. And so he was looking at this as, hey, we can use this to identify where DNA comes from. You know, if
Okay.
we find DNA in the blood, did that come from a cancer cell? Did that come from a brain cell? Did that come
Mm.
from an intestinal cell? We can find that not by the DNA sequence, because that's the same for all of those, but by looking at these chemical modifications that are unique to each of those tissues. Okay.
Okay.
And he was using it in a fertility context. And one of his students came and said, hey, people that have Alzheimer's disease or other forms of dementia, they have neurons that are dying. And when they die, they spill their DNA into the blood.
Yeah.
Couldn't we look for these methylation patterns you're looking in fertility to identify brain cells that are dying and putting their DNA in the blood? Right. And so now and then they started to look at that and they said, well, we don't really know how to do this from a technology point of view.
Yeah.
Right. And so they came to me and I said, oh, well, we could do this and that and the other thing. And we kind of built a plan. So without all three of us and our unique perspectives and questions we wanted to ask and skill sets that we have, this never would have gone anywhere. Right.
You know what's
Um,
fascinating about that? And I love this is I talk a lot about how important it is as we look at the advancement of tech and where we're going and how important it is to have diverse perspectives in the conversation because everybody
yeah.
holds a little bit of the key to the bigger problem. And you just illustrated that with that where like you had one looking at it through this lens, somebody else went, hey, did we think about that? And they both went, I mean, that's a good idea, but I have no idea if that's and then you come in and go,
Yeah.
oh, we could if we did it this way. And I think that collaboration showcases why it is so valuable when you bring a diverse group together to go, well, how might we actually solve this problem or even identify a problem we maybe never
Right.
thought to even solve?
Yeah, and I think as a culture, we have this view of invention as being like some guy hunched over a workbench in his garage working completely alone, right?
Right.
And that's not
This
how it usually
rugged
happens.
individualism where somebody with the brilliancy of whatever was
Yes.
sitting in a room by themselves, drumming it all up.
Yeah, and that's not how it works, right?
No.
Everybody works in team. I mean, you even think of the famous people, everybody talks about Edison inventing the light bulb. Well, actually, it was him and a whole bunch of other workers that were working on it.
All right, let's not get into the whole Nikola, Tesla, Edison, whole thing there.
Yeah, yeah. We got rivalries, different teams. They actually,
but I mean, competition's another thing that actually drives innovation sometimes.
Yes, and we actually should go there because they came up with unique solutions. And if you look at our modern society, sometimes we sided with Edison and sometimes we sided with Tesla.
Yeah.
And that competition and different viewpoints, again, a different kind of diversity of viewpoints in here. Instead of working as a team, they competed, but that also can really help. Right?
It definitely can play a role in it.
Steve Jobs didn't invent the Mac by himself, et cetera, et cetera. This is not how innovation is done. It is done in teams.
Yeah.
So motivated by competition is what I would say.
Yeah.
Teams working to compete.
Yeah. Okay. So now you start looking at that and going, I think there's something to it. And now where is that going?
Yeah. So we kind of came up with this technique. So our original product that we were looking at was diagnosing Alzheimer's at a very early stage. And this is important because they're starting to come out with drugs. There's a couple out. There's a whole bunch of clinical trials that can slow the neurodegeneration down.
Yep. Yeah, if you catch it, I mean, like most diseases, the earlier detection, the more likely you are to either mitigate, treat, or potentially cure or eliminate the disease.
Yeah, and this is especially true in neurons because neurons don't divide. They can't repair. So once they're gone, they're gone.
They're gone.
So you got to stop it. You got to catch it early and stop it, right? But the problem has been that the diagnostic techniques don't have the sensitivity to catch it early, pre-symptomatic. They're all well down the road and you already have severe dementia before they can confirm, oh yeah, you already had this kind of thing.
Right. Right.
So
yeah,
we start looking at
and unfortunately we can't undo it. So the best we can do is slow down how much worse it's going to get.
Exactly. So we've actually taken banked blood. We've started looking at this. Our preliminary studies, we published one paper on it, show that we can detect Alzheimer's up to 5 years before it's diagnosed in the clinic. And so using these methylation marks, we can really say, hey, you've got neurodegeneration happening early on, get that early diagnosis, get the early treatment. And we're, of course, doing the clinical validations and refining everything before we can release it. But it's a really promising technology. But the first idea was, okay, now we've got this technology. Let's license it to somebody. The kind of classical, we did the research. Now someone's going to take this.
Yeah.
And they went out and they got some investors and they came back and said, there's not a lab in the country that can do this.
Wow.
You're using unique technology that you guys have created. And we were using nanopore sequencing, which is a newer sequencing technology that hasn't been widely adopted yet in the kind of commercial clinical space. And they said, nobody can do it. So we said, okay, we're going to have to start our own lab. Right.
You didn't talk to Theranos or anything? I mean, maybe they
yeah, they were busy.
They were busy. Yeah, they were busy with some legal troubles.
Yes. So the lawyers got all the appointments. We couldn't squeeze in. Yeah. Actually, it's funny you say that because we often have a mantra of "Don't be Theranos," right?
It's a good mantra to have.
Well, and it's because we're looking at doing blood diagnostics that people are like, "This isn't possible." We're just close enough.
I mean, as much as
to say, "Hey, we better be careful here."
Yeah, well, but I mean, as much as we're joking about it. In many ways, I can see where that could add to potential hurdles and headwinds that you would have to overcome because there is now natural skepticism over some of these things, because when you have bad actors that get into things, which maybe even well-intended, they get carried away with their stuff. And then all of a sudden people go, I don't know now, really. And you're talking about DNA sequencing for diagnosis through blood. And people start going, is this smoke and mirrors?
Sounds too good to be true.
Yeah. Which goes back to what we talked about with the change management. When you're in these early stages and it hasn't been done, it hasn't been proven, there is this heightened skepticism to, are you sure? Like, this sounds really, really phony.
Yeah, I mean, so one of the classes I teach at BYU is the research ethics class for the graduate students. So I could go on forever for this. This is a conversation for another day. But bottom line is one of the important things of being an ethical person in an ethical company is that it doesn't just harm you when you get caught, it harms others as
Lots
well,
of other
right?
people.
And then people are harmed because now the technologies don't get out as fast, et cetera, right? Like it has real negative impacts on people.
Yeah.
Often people talk about, lying on financial documents or whatever as a victimless crime kind of thing. No, it may not be direct. I didn't hold a gun to your head, but there are impacts and there are
Yeah.
costs that people have to bear
Well,
because
even
of that.
even like we said, the erosion of trust and the downstream implications that that has on so many things. We were talking backstage about the guest that it's coming out, I think, late in July or August, but who's doing olfactory science with AI
Mhm.
and just some of the regulatory hurdles that they're having to go through. And a lot of people go, well, if we know how to do all this stuff, why is it not in our doctor's offices yet? And it's like,
Right.
well, it's because for good reasons, there's a lot of scrutiny and a lot of hurdles that you've got to jump through to be able to get stuff to market because people want to make sure it's safe, especially when you're dealing with healthcare stuff.
Yes.
And I think about, diagnosing neo or degenerative diseases. You don't want to tell somebody, hey, turns out you've got this, only to find out, oops, I guess we were
Yeah.
wrong,
We were
type of
wrong.
a thing. Yeah.
Yeah. I mean, at least diagnostics have lower hurdles than an actual treatment because
They
you're
do.
not ingesting a drug when you're getting a blood drawn for a diagnostic,
Correct.
right? So there is a lower burden there. But yeah, it's complex and it's important to people. And so they're going to say, I want someone to check this for me, someone who actually understands it to look at it and assure that it's safe and effective and accurate, right?
Yeah.
And that makes a lot of sense. Lots of questions in the details of how to best do that, but I think that principle is pretty widely accepted out there. So
Okay.
anyway, so we started our own lab and we've taken kind of this collaborative approach into the lab and we've said, hey, some of these techniques that we've developed or refined in order to do our test really creates a technological platform that can be used for lots of different tests.
Yeah.
Just change the computer models and change the different analyses on it. And you can apply this to lots of different areas. And
I mean,
so
that's the
we've
beauty. As I'm
also,
listening to you talk through some of this stuff, again, it's like unlocking a secret code that you're like, well, once
yeah,
you figure out the pattern, suddenly you can go, well, everything has a distinct pattern. So, yes, we have to train the technology on the different patterns to figure them out,
right.
but the foundation is there.
The data
Translating it
is the
into
same.
different capacities suddenly becomes not easy, but easier than when you're first cracking the code.
Right, exactly. And so we've also built Wasatch to be a lab that is open for other people, right?
Okay.
We understand that we're not going to think of every use case for this. Again, that kind
No.
of team attitude of innovation. Others will think of things that will go, oh, yeah, our technology would really help with that. We hadn't even thought of it, but that'll help. And we can partner with these people and build that as
Okay.
well. And then we have the expertise to run it. We're just turning in our first CLIA submission. CLIA is the kind of regulatory body over clinical labs. And so we will be a CLIA environment here in a couple
Okay.
weeks or months. And then, we can go to these partners and say, hey, you have this really cool use case. We're going to partner with you. We'll help you develop it. We have a CLIA lab to run it in. We
Okay.
have people that can help you with your CLIA certification and, really try to make sure this has the biggest impact that's
Okay.
possible out there.
What I
And I think
like
it's going to be
to,
really cool.
well, and two things you just hit on there that I think are really interesting and encouraging for people who may not be as familiar with this space is, first of all, one, I love the fact that you're taking that approach of, hey, like we've done this work and it's really good, important work, but we can't possibly know all of the different possibilities. And so rather than try and hoard it and go,
Hmm.
well, we're going to keep this to ourselves because somebody else might figure something out, having that kind of growth mindset of, well, we've done it. If we raise the tide, other people can do it. I think that's fantastic because sometimes when I see people try and go down this path of, well, it's mine and somebody else might take from me, they end up spreading themselves too thin because
Yeah.
they're trying to be everything to everyone, and as a result they're really not very good at anything to anyone, and it ends up just causing them to trip up over it. But I also think it's pretty incredible that you got those certifications, because what I've seen in the healthcare space is some of those initial burdens are like the hardest. And
Yes.
once you can cross those initial burdens, it opens up other doors that make it easier for other partners to come in, other people to work with you. And then there's almost a snowball effect that happens where you go, hey, like we did this, we went through the initial stuff. Now this is moving. We can actually start moving it faster and faster.
Yeah, I think you hit on the head. We get trapped in this kind of no sum game idea, right? Well, if they do it, then that took away from what I can do, right?
Yep.
But we like to view it as more of a win-win type situation. We've got people that have expertise in diseases and different models, et cetera, that we don't have, and we'll never think about them. They're complete blind spots for us. And yet, if they developed on their own, well, guess what? They're going to get to a point where they're going to say, oh, there's not a lab in the country that can do this technique except for us, right? And so it's beneficial to them to not try to reinvent everything and figure out everything we've done, but to partner with us to actually be the processor of their samples, right?
Yeah.
And on the regulatory front, we are running into some hurdles, to be completely open and honest.
Everybody does. Just say, I've worked
Yeah.
with so many healthcare. I don't know anybody who's gotten into anything healthcare related and gone, you know what? This was really easy.
Right.
We just sailed through it. No big deal.
Yeah. That would be great to hear, right?
Yeah, right.
But especially when you're working with a new technology,
Yes.
right? We ran into an issue where, one of the things CLIA likes to do is to have kind of gold standard samples that you can run and show that you can get accurate results, right? That's an important thing to show. Well, they don't exist for what we're doing because nobody's ever
Right.
done it. And so, and we have the one technology that can do it accurately. And so, what do you do when there isn't an outside gold standard to compare to? When nobody has a bank of samples because they've been doing this for 10 years, right? Like these things don't exist.
No.
And so we need that synergy to help people see what they can do, but then let us go through the hurdles the first time and use that information to benefit the next test and the test after that and all those kinds of things as we go forward. And both will be better off in the end. It's win-win. It's not a no-sum game.
And I think that going back to some of the challenges with innovation, and again, it's very heavily felt in healthcare, but I see this in a lot of different areas, is where people go, well, in order for us to feel comfortable with this, we need to have comparative data against, like you said, some sort of gold standard. And when it's innovative, it doesn't exist. There's nothing to compare it to. And you get in these very difficult situations. I mean, like I said, having been in specifically pharmaceuticals, I saw this all the time. It was a pain to get through the regulatory process for things with indications that already exist. Just to get a new indication on an existing product was a nightmare. If you were treading into an orphan drug status or something like that, where it's like, well, how have we done this in the past? And you're like,
nobody has.
We haven't.
Yeah.
So what do you want us to provide? A lot of times what ends up happening is, and this is one of the real challenges with healthcare and other areas, is it's like, well, then the only option we have is time. We just have to wait to get conclusive data on this stuff. And then unfortunately, a lot of times these things get just trapped in a cycle of, okay, well, I mean, I guess we can wait, but then these are people who are going to be impacted through this time because we can't move it forward. So there are some real challenges that I have tremendous respect for, people who are in the healthcare innovation space, where it's like, this is no easy mountain to climb.
Right. Yeah, luckily we do have genetic testing, and we're kind of saying, hey, chemical modification testing is like genetic testing. And we're building what we do off a lot.
So you've been able to find some of the comparators to be able to go, well, it's not exactly the same, but close enough that we
close
feel
enough
like
that here's the data they gave you, and here's our data that looks a lot the same, right?
Okay.
We can make it look similar and do the same kind of validations to try to do that. But yeah, so there's extra hurdles. We know that. We'll accept that. You got to do it. Somebody's got to do it, right? So I guess we really believe that these chemical modifications, because they're not static through your lifetime, are going to be hugely beneficial as biomarkers in the future. So it's worth getting through those hurdles. as we
So
go
for
through.
what you're doing, and then I want to transition to kind of like what's next. But as you're looking at the applications of how you're looking at using AI, and I actually also want to compound and unpack where AI comes into this, because people may be going, okay, you talked about this, but where does the AI come into play? So as you look at this, how are you, applying that technology to some of this stuff? And I think if I'm understanding you correctly, the direction you're going with it is primarily around diagnostics and being able to
It is.
detect diseases, find ways to get earlier detection, detect diseases that maybe we don't have easy ways to detect, or ways we detect it, it's too late or it's highly intrusive, things like that.
Mhm. Yeah, I think to talk about AI, I think I have to really talk on 3 levels,
Okay.
okay? The first level is the very basic level.
Okay.
Um, the sequencer that we use in all of our tests is a nanopore sequencer, and nanopore has a unique technology. I can go into it if you want, but the bottom line is that the base calling, the calling of ATCG as it reads through the DNA sequence, is actually done based on an AI model.
Okay.
The signal that comes off the machine is a complex pattern. The AI model then sees that pattern, looks at that pattern, and figures out what the DNA sequence underlying that was.
Okay.
So you've got kind of embedded within these individual technologies that we're basing on, you've already got AI involved in those key
Yeah.
steps, right?
Well, which makes
Then
sense
there's
because, again, we going back to what we talked about earlier, there is these infinite number of patterns that would be extremely difficult for a human being to ever just sit down and try and make sense
right.
of. And so even being able to say, hey, this is a pattern, is where an AI can come in, or AI can come in and help with that piece.
Yeah, and even if we could, we typically right now we're getting anywhere from 120 to 150 billion bases off of a single run. And so even if we could find those patterns, we don't have time to sit there and do it, right?
No, to comb through
So
them, you'd be
yeah.
centuries. People would be sitting staring at this stuff.
Yes, exactly. I mean, it took years to copy a Bible back in the
Right.
medieval times, right? Imagine
Right.
trying to copy the human code. It's not going to happen. So, um, so yeah, so you've got that kind of foundation. Then you've got what you've already alluded to. What we're basing our diagnostic off of is figuring out, hey, I got this little piece of DNA, it had this complex pattern of methylation on it. Which cell type did it come from,
Okay.
right? Again, you're talking about complex patterns and signals within a complex pool of DNA. So you can see
Okay.
how different kinds of AI models get involved, different stages there to classify these DNA sequences as brain derived or gut derived or wherever they came from,
Okay.
right? Um,
Which, as I'm thinking about these two layers you're just in, and then we can keep going on this. For people who may not be as familiar with the tech, some of the ways, and you tell me if my comparison is at least relatively reasonable. I think of that first layer you talked about is, when you apply AI to, let's say, this video, the
mhm.
transcription is kind of that base layer where it's like it's taking in that audio, and it's just, it doesn't make any sense of what it is, but it's actually saying, I'm taking this and now figuring out the pattern, that there are
Yeah, changing
words.
it to a different
I'm not
form, right?
changing it. Right. I'm not changing it. I'm not modifying it. I'm not even really telling you what it is. I'm just
Mhm.
literally going through and taking it from a format that would have been very difficult for a human being. Like, I think about video. If you wanted to watch a video, it's a lot of work to watch a video, listen, like go through all that. So to actually
Mhm.
take that and then say, here it is in text form.
Right.
It's unmodified, but that's kind of that layer one. That layer two then is coming in and going, all right, now we have all this stuff. Let's start to make sense of it.
Yeah, you can think about the AIs now that will take and record a meeting like this, for example, and then give you a summary of the meeting.
Yep.
Here's the
Yeah.
important points that were brought up. Here's the questions
Yeah.
that were
These were the
asked.
key transition points. Here's some of the
Yeah,
major topics. It's actually taking that just wall of text and actually making sense of it in a
sense
way
out of it.
that you would then look at and go, oh, okay, that's what happened in this. The transcript itself does not do that. That'd be that layer one. Layer two then is going, we're going to make sense of this in a way that a human can look at and go, ah, okay, that makes sense for what we could do with it.
Exactly. So that's that second layer that
Yep.
we're talking about, right? Now, the third layer, I think, is going to be very interested moving forward. And I think we're at the very beginning of this. And that is that those AI outputs there become in the future, I believe, the AI inputs for medical diagnosis,
Mm.
right? Medical diagnosis, by its very nature, is looking at noisy data,
Yeah.
complex and different data sets, and trying to interpret them all together in order to diagnose a disease, right? Or make a
Yep.
prognosis, things like that. Doctors get years and years of experience and they eventually get pretty good at doing this in specific use cases, right? But imagine an AI that can take data from our entire population to build models. It would be like seeing billions of patients, right?
Yeah.
Through your
Yeah. Well,
career
and I
and getting that
so
experience.
yeah, like translating it to our analogy, it's almost like now you're taking layer three is taking all these meeting notes that have been organized in a certain way, and now layering AI on top of all the meeting
All of
notes
it.
across all of them and going, make sense of what's going on across this that we can learn from that might help us get better at even so it almost becomes cyclical in nature, but you're doing it on a scale where you might have a human diagnostician who sees hundreds or maybe thousands of patients over their lifetime, and they've started to put a few of these pieces together. They've looked at enough summaries of these meeting notes to go,
Hmm.
I'm pretty good.
Got an
But
idea.
even the best in the world has still seen a very, very, very narrow portion of what's actually out there.
Right. So what I see is the future of medicine. First of all, I see us paying attention to diagnostics a lot more.
I agree. I agree.
Unfortunately, my experience in the medical field is there's too much of guess and check going on. Uh,
I would agree with that. We talk
yeah,
about preventative medicine, but a lot of times it's much more like, well, I think.
yeah, um, yeah. How many times have I gone into the doctor? Well, I'll just share one example. It's a little bit embarrassing, but it's a good one for this. So I was having like essentially severe athlete's foot on my feet, right?
Okay.
But the normal athlete's foot type stuff wasn't touching it, was not
Yep.
helping at all. Severe discomfort, itching, etc. Right? So I finally go into the doctor and I say, "Here's my problem." He goes, "Huh? Try this cream for a week and call me if it doesn't help." Right?
Yep.
So I use this cream for a week, nothing changes. Call him up, he goes, "Come back in." Comes back in, he goes, "Ah, I thought it was that. Try this different medication for another week." So I go home, another week, nothing. I go in, he goes, "Huh, we really got to look at this." And he takes some scrapings off the top of bottom of my foot, goes into another room to a microscope and looks at it and goes, "Oh, now I know what you have." And he prescribed something else. I took it and it went away. And my immediate thought was, why didn't you do that the first time I came in? Right?
Yeah.
Why was the proper diagnosis based on evidence not your first line? Why was it your last line? Right?
Well,
And we
and I
see
think, but I
this
think some
throughout
of the challenges, and
medicine.
I think this is where technology is so exciting for this. Now, granted, in that example, it is one of those things where it's like, dude, you could have scraped my foot and looked, and that was it.
Yeah,
But I think in other areas, diagnosis is often it's very
hard.
expensive. It's a lot of work. It's a lot of appointments. It's a lot of, this and that. We need to get you in for a CT scan. We need to do a
Yeah,
biopsy. We need to do all these other things. And so as a result, I know not only do you have the healthcare physician challenges, you also just have people and human behavior who are like, I don't, what, it's bothering me. It's not bothering me that much. I
bad.
don't
Yeah,
want to do this type of a thing. And so it becomes you have people going, well, I'm going to go based on my best assumption, based on what I know. And like you said, it's a lot of guess and check versus if we can get to a point, and I think this is what's really exciting about technology and healthcare, where with a very simple thing, we can, with ridiculous accuracy, go, oh, that's what you have.
exactly. And there's challenges though, right? Let's take cancer, for example. Having a
Yep.
mutation in the BRCA gene does not guarantee someone that they have breast cancer, right? Having a bright spot on an X-ray film does not guarantee they have
No.
cancer, right? And you can go through these kinds of different things. It is the combination of all those things together that would be used to make a diagnosis,
Yeah.
not any single data point. And so this is why I see AI becoming hugely important,
Yeah.
because it can understand all the different kinds of data. It can put things together in unique and non-obvious ways
Yeah.
and be able to figure out these patterns, right?
Well, I think that goes
Um,
to that layer 3 you were talking about, and why that layer
yes,
3 is so powerful, because when you're working on that, even layer 1 and layer 2, it's helpful, it's a step up, but that still may seem like an anomaly or something like, well, I've never seen
right.
this before. And it's like, well, but that's because it's your limited experience. If we now look across the spectrum of thousands, millions, you know, potentially billions of data points, that no longer looks like an anomaly, because we can see the multiple patterns coming together and going, oh, actually, we know exactly what that is.
Exactly. And so I see us getting there in medicine,
Okay.
and it will be hugely beneficial. Just a little other anecdote. I would participate in study here at BYU. Every so often, let them use me as a guinea pig for science. And in this case, they had done an MRI of my abdomen kind of thing. And I went into the doctor after that to have something checked. And I told him, I said, hey, I got this MRI done. Would you guys like this? And he looked at me and said, I wouldn't know how to read it anyway. Right. It's not his specialty.
Yeah.
And so we've got to be able to quickly, using computers, using AI, be able to bring all these different kinds of data sets together in unique ways. And it's going to be really cool. The next place my mind goes, though, is let's walk back down. That AI doing the diagnosis in the clinic is no good unless it has good, accurate, clean input data,
True.
right? Every AI is completely dependent on the data that was used first to train it and then to actually make the call on, right?
Yeah. I mean, a good example of this gone wrong that recently happened was, I don't know how much you follow this stuff, but the big AI players hooked Reddit up to their search results, and within seconds you suddenly saw the recommendations coming back from things when people were searching things as like, are you like, that's what your suggestion to this is?
Yeah.
And it's like, well, but it's pulling from an unclean data set. And so
Hmm.
it's just going, well, I mean, I don't know, garbage data. I guess the best I can make sense of this is this. And it doesn't have that context to go, this is really bad.
Yeah. AI has no values, it has no context, it has no real, I would say, understanding, although it appears to often, right? It is
It
finding
gives the
patterns and
appearance
making
of it, but
conclusions.
it doesn't.
Yeah. Even ChatGPT doesn't really, I think, understand what it just told you.
No.
Um,
No, I
and
feel like in
so,
some ways the comparison I that I think is actually kind of a dangerous thing when we take it too seriously is, it's almost like a sociopath or a clinical narcissist that has
yeah,
learned the patterns, and so it knows what to say, but it doesn't actually feel emotion. It
feel it.
doesn't really know what
Yeah.
it's doing. It's just like, well, I know this is what I'm supposed to do based on everything I've learned and the cues I'm supposed, and so I'm spitting it back. But we can interpret that and go, "Oh, wow, you
Yeah.
really understood." And it's like, no, it
ChatGPT
didn't.
cares about me. No,
Yeah,
it doesn't.
ChatGPT cares about my feelings. It's like, no, it
Yeah.
doesn't. It just saw
Yeah.
what you asked and it interpreted it and it gave you what it thought you wanted.
Yeah. Exactly. So, input is hugely important. So now you got to walk back
Yeah.
down, right? I think the ultimate goal is this kind of diagnostic AI, right? It's a perfect use case for it, be hugely valuable, lower health costs, increase access, decrease turnaround times, improve patients. There's huge benefits to it. But for that, we need really good diagnostic tests that can give it clear answers and data points that it needs to function,
Yeah.
right? And we need those to be accurate, low cost, accessible, all these kinds of things. And for that, we need the tools that these diagnostic tests are built on to
Mm,
also be very clean and strong and robust, right? Like,
yeah.
and so where our innovation has been is improving the inputs into our models. We haven't
Okay.
done any innovation per se. There's nothing super unique about the pattern recognition models that we're doing, right? What is unique is how we got the data for those.
Okay.
Um, some of the ways we can clean it up, some of the ways we can have changed how we process the DNA to do things like prevent synthesis of new nucleotides, because synthesis of anything new does not have a methylation mark. And
Okay.
so it will mess up your signal if you're trying to look
Yeah,
at
it'll
methylation
corrupt. I mean,
patterns,
it'll
right?
literally corrupt the data set.
Yeah, so we've removed all that, right? Things like that in order to get the best data we can to make the most robust call we can, because
Okay.
that's going to inform either doctors or in the future other models on something that's going to really impact you as a person,
Yeah.
and your healthcare.
And so that speaks to something, and I'm curious your take on where we are with that. But I think it speaks to something that a lot of times gets missed as we think about technology, and especially as this AI boom hits, is we're often focused on the end product instead of like, hey, we got to move as far upstream as possible because
Hmm.
basically, if you don't get it clean up here, all AI does is accelerate and exacerbate all the exploits in the system downstream. And if you don't catch it early, it's just going to be exponentially worse on the end. So when you think about that on kind of that front end diagnostic side or where those data inputs are coming in, what are some of the challenges that you're facing and that you're kind of digging into going, man, we got to get this right so that we can continue improving on the innovation?
Well, I think I hit on the biggest thing. First of all, uh, that biggest thing is that you want to make sure that the things you're doing to kind of clean up the DNA aren't actually causing problems in it,
Okay.
right?
Yeah.
Sometimes we're
Yeah.
like we get hyper focused as people, and so sometimes we're like, oh, I need to clean up the ends of my DNA pieces so they'll sequence better. And we don't realize we did that by synthesizing new DNA at the ends, and we just
Yeah.
messed up our signal, right?
Okay.
You've got to have that kind of big picture
I mean, in some ways,
view on things and
I've
think
seen this
about it.
happen even in the business world, where you can become over obsessed with too
Hmm.
clean of data, and you don't realize that cleaning your data, sanitizing it to a certain point, it's like, well, you've actually foundationally changed the data now, and
Yes.
so you've actually corrupted it because you were obsessed with, well, if we just make it nice and clean, won't that be better? And it's like, well, no, we actually kind of need it to be authentic. We just
Right.
don't want noise in it.
Yeah, you can clean the signal right out of it, right? Which is a problem. So yeah, so you got to be careful about that, and it just takes, I think, focus and an active kind of intentional view of it, right?
Okay.
That you're going to check those things. The other thing we've done is you remove as many steps as possible.
Okay.
So typically for methylation calls on DNA, I'm going to get a little scientific here, but the
That's
details don't
fine.
matter, just the list,
If
right?
it gets confusing, I'll ask. Don't worry.
Yeah, well, just the idea is how many steps are involved, right? So
Okay.
you would isolate the DNA, you would
Yep.
fragment it, you would put adapters on it, you would do a chemical conversion process that changes the methylation
Okay.
into a signal that can be read,
Yep.
called bisulfite conversion. You then do a PCR on that. You then prepare a library, then you sequence it, right? So on my hands, I counted 7 steps in order to get that DNA in there, any one of which can go wrong,
Yep.
right? And that is bad because now you just messed up your data, often in ways that you can't, especially in methylation data, when unmethylated is an answer, you can't tell if that's your answer or if that was a mistake, right? They
Yeah.
are the same
Yeah.
signal that are generated. So we took that and we said, no, let's make sure that we're using technology and reforming some things where we can take DNA, fragment it, and identify the methylations. 3 steps
Okay.
instead of 7.
Okay.
Cutting all of the others out, cut all the noise that they produce
Okay.
out.
Okay.
So now we have much cleaner data, right? So that's something that we're thinking about all the time is
Okay.
can we remove steps? Not just because obviously it's faster and cheaper, but because it's better for the data, the
Yeah.
more directly that we can measure it.
Well, and I think the wisdom in that is again transferable to anybody. And this is why a lot of the advisory work I do around AI is like, let's clean up and optimize processes first,
Mhm.
because not only, one, to your point, does it make it faster and cleaner and better? I mean, yes, that's good, which is a traditional reason you do process optimization. But another big one is, like you said, each step introduces opportunity for something to go wrong,
Right.
which then, especially with AI, where everything just gets amplified and accelerated at an exponential rate, it just becomes that much harder to go, wait, did it break at step 3 or 4
Yep.
or 5? And if it broke at step 5, was the break related to it? It just becomes that much harder. And a lot of times people are just like, well, can't we just jump straight to it? And I mean, you can, but I found it actually creates more of a mess.
Yeah, and a blind spot I've seen at least some people have that I work with is when they see something like that, they say, "Oh, we just need a larger training set." Right? A larger training set solves all issues. And we've said, "No, let's step back and say, Do we need a lot, like larger training set is the last resort solution,
Yeah, I
right?
agree.
If we absolutely cannot get rid of the noise, yes, we need more training data so that we can
Sure.
get the model to recognize and compensate for that noise, right?
Yeah.
But
But as a
better is to
last
eliminate
resort,
it.
as a
Yeah,
last resort. Yep.
yep. Cars driving on the road, there's little they can do about a lot of the noise they're going to have in their signals. They got to have large data sets. We're
Yep.
in a lab. We can control a lot of this. And so we step back and we first say, how can we clean up the data
Yep.
rather than just rely on bigger and more complex models,
Yeah.
right?
And it's funny. I've seen this go sideways sometimes, especially as AI generated data is becoming more and more a bigger thing. And people are using that to create larger data sets. But to your point, it's like, well, I mean, we can create the biggest data set in the world, but if it's still riddled with noise, it's the noise is still polluting it. And granted, yes, if you can't isolate it, okay, sometimes you have to work around it. But oftentimes you need to go through the level of, can we isolate it without, to your point from
Yep.
before, isolating it to a point where you sanitize it down to the level where it's like, well, now it's not telling us anything because you just neutered it.
So here's the last crazy thing that you may not like as an AI person. Sometimes we found in certain cases when we've done that optimization, made the data super clean, we've investigated the models and looked at what it's looking at, et cetera. We've actually realized, hey, that's a strong enough signal that we don't really need AI anymore. We can do a much simpler regression model and get our answer, right?
No,
So we actually like
that
those because then we don't have a black box we're submitting for regulatory approval,
I
which is really
actually
nice.
no, even as an AI proponent, I'm an AI proponent where AI makes sense. And I think that's
Mm,
where oftentimes, there's this like, let's use advanced AI for everything. And it's like, honestly, there are times when the complexity and the uncertainty that comes with it, it's not worth the risk. And
yep,
chasing it because it's the thing, actually, in my mind, is really foolish. And sometimes traditional methods are actually more effective.
right.
It's really when you actually narrow it down and go, does this make sense? Now, granted, I think the things we talked about today really highlight these were bottlenecks or barriers that
Yes,
could not have been overcome without it. And I think
right.
that's one of the things where when you run into scalability, when you run into complexity problems that you go, there's just no other way around it. It makes sense. But I see people oftentimes going, how do we make AI do this? And I'm like, what? Why would you
Why?
want to? Like, it doesn't, it's going to make it worse. Like, I don't
Yeah.
understand why you would do that. So no, I'm not offended one bit.
Okay, good. Because yeah, we figure there's enough AI at multiple steps along the way. If we can pull it out of one stop, reduce complexity, reduce uncertainty, especially you got to think regulatory.
You
It's a
do.
lot harder to go to FDA or CLIA and say, we don't know how this works, but it seems to, right?
I know.
Than
And
to say,
explainable AI, as much as it's talked about, is nowhere near it needs to be to make
no, and
regulators feel good.
I don't think that's its strength. Its strength
No.
is when the patterns are so complex that you can't really grasp it, but
Yep.
it can make it work, right?
Right. Right. Because
Um,
if we can
but
explain
if
it,
we
we
can
can probably
show them,
do it.
yeah, here's a regression curve and why it works, then they can see it and we're good, right?
Yeah.
So we are always looking at that. What is the simplest model we can do? Um, how can we do stuff? And often it's iterative. AI helps us discover things, and then we
Yeah.
create a model based on what we found with the
Yeah.
AI that's simpler, right? Things like that.
No.
So,
And you know what? I think as kind of a concluding point that we just highlighted here, which I think is really good, is, there's a lot of this out there that like I see it in the media hype all the time. Like AI is coming for everything. It's going to take over. And what we just talked about at this endpoint is I still don't see a world where that happens because there are certain things where you go, it actually causes more problems when it's used incorrectly. And I think, yes, we're in this weird stage where we haven't quite figured out where correctly always is and where
yeah,
incorrectly is. And so this perception is, well, anytime we use it, it's better. But I think we're discovering more and more that it's like, well, actually, it's not better over here. And if we apply it, we're actually making a bigger mess. And so I'm actually excited over the next few years as we start to make more sense of that. Because I see some people making some cosmic mistakes right now that I'm like, we got to learn fast or we're gonna get ourselves in some real hot water.
Yeah, no, and I see it. I won't cite specific examples to not throw anyone under the bus, but I see it in DNA all the time. Every new biotech company, we're using AI for XYZ, and often I look at it and go, "You don't need AI for that. We've been doing that for 20 years," kind of
Right.
thing. But they put AI and investors jump, right? And so,
Well, and that's, I think we're in the hype cycle now where there's a temptation for everybody to say they're using AI for the sake of using AI instead of AI with purpose, which that's where
right,
I've really enjoyed this conversation because I think we did a really good job breaking down how to do that well in this space. And there's a lot of transferability across the board. So Dr.
I agree.
Jonathan, this has been awesome. I have thoroughly enjoyed our time. I love nerding out on this stuff. So thank you for making the time with me on a Thursday. Really enjoyed it. And I hope everyone who watches, listens to this, one, things make more sense. Hopefully it makes AI and healthcare feel less scary, but it also makes you really excited and optimistic about where we're going because there is some really exciting stuff happening. And I love exploring true innovation in the space. So thank you.
Thank you. It's been fun talking to you. I think healthcare is something that matters to people. It's complex. It's not the most efficient field, and I think technology is going to help that in the future, make it a lot better for everyone.
Completely agree. Well, thank you again for your time. Thanks everybody for watching, listening, and we will see you on the other side.